We're live.
So we're back after a quick break, the Senate Education Committee. And now we're switching gears and we kind of have an annual update from Building Bright Futures, and today's the day. And with Gordon Cluster from Building Bright Futures. So the floor is yours. Introduce yourself for the record, and then the floor is yours.
Thank you. Well, good afternoon. I'm Dr. Morgan Crossman for the record. I am the Executive Director of Building Bright Futures, which is Vermont's Early Childhood State Advisory Council. And what that means for you all is I'm your primary advisor on kids and families prenatal to age 8 across every system of service that is touching kids and families. So not just childcare or pre-K, but really thinking holistically about the system of services for children and families. My job is to bring together an entire network of partners. There's over 500 partners who are coming together over the course of the year to serve in this advisory capacity. So our job is to advise this group, but also the governor's office and our federal delegation, and to bring those partners together to understand the needs of kids and families on the ground, to be documenting what is happening actively related to law and policy in the early childhood arena, to elevate voice and really be able to share lived experience as qualitative data with you all, but also to very formally monitor the system of services. So we are the source of compiling all of the data that you generally are hearing on behalf of kids and families. Today, I'll give you a big high-level snapshot of some of that data. I'll also talk about the Act 76 monitoring data, so the child care law that was passed, and really focus efforts on pre-K as the priority that will be tackled this year as part of education transformation. So any question on our role?
Just remind me, are you legislatively established?
Yes.
Yes.
So we are named in both state and federal statutes as your primary advisor on kids and families. We do receive a legislative allocation that's routed through the Child Development Division. And we partner really closely with all of the agencies, departments, and divisions, as well as community-based partners to centralize all this data for you all. So as you're thinking about our role and this session, any of the questions that you may have around what data exists, which partners to connect with related to pre-K or early childhood or elementary education, happy to be a resource in that way. All right. Just wanted to give you a quick view of the current configuration of my board. So again, being named in state statute, we have very concrete roles and requirements on our board. On the left-hand side, you're seeing our public or agency leaders. The ones at the top are those that are required to be a part of the board across, mental health, maternal and child health, or family and child health, Head Start, Commerce, Child Development Division, Secretary's office seats. You're also seeing that we collaborate really closely with non-voting public members. So working really closely with the governor's office, as well as some of the other deputy commissioners. We do have legislative leadership. So right now, Representative Garofano and Senator Gulick serve on our board. And we also have a range of required community-based and other partners across the system of service to bring their content expertise. So just as a reminder, this is that configuration of the board seats. One of the things that I want to orient you to briefly today is the next 5-year strategic plan for kids and families. So one of the roles that we play, sitting just outside of state government as that nonpartisan data advisor, is that we're charged with building and then holding the vision for the state strategic plan for kids and families. It's a 5-year strategic plan. It was just published in the last couple of months. So I'm not going to do a full orientation today, but we have now established after, contributions from over 300 Vermonters over the course of a year and a half, this new statewide shared vision and roadmap for kids and families. It's meant to be a plan of plans. So partnering with all of those agencies, departments, and divisions, but all of the community-based partners to say, what are the needs and how are we documenting continuously what the needs of Vermonters are, but then also really having it grounded in lived experience and the data that we have over the last 5 years. And so what's really interesting is we heard so much from families and those on the ground that basic needs needed to be at the foundation of all of our work. So you're seeing that first goal really grounded in basic needs: economic security, food security, housing, and transportation. We're gonna, this is a publicly available document, so I'll send you the link to that. But in terms of how this group can use it, I will walk you through what's in it specific to education and then point you to different areas and data as well. But just to give you that sense, goal 1 is really around basic needs. Goal 2 is focused on health and safety. So how do we make sure that children are being raised in safe and healthy and healing environments? Goal 3 is all about opportunity and making sure that children and families have access to high quality inclusive opportunities for development and learning. That is where you're going to see the majority of the pre-K and education work, education transformation components. Goal 4 is workforce. That's a new goal for this strategic plan. Again, mapping across every sector, mental health, education, paraprofessionals, really thinking about how to support the early childhood workforce. And then goal 5, also really important for this committee, is about both centering family voice, but data-driven decision making, and making sure that we are actually as a system saying, are we doing what's in the best interest of kids and families? How do we know? Is it resourced to the right level? Sure, go ahead.
To all children raised in a safe, healthy, healing environment decides what that scope looks like. Because the way I might raise my children is different from the way you raise your children.
Absolutely.
So how does the decision come to say, okay, this is the right way?
Yeah. So when we think about the context that children live, grow, and development, we have our family units, and that is where we're absolutely saying families are really important, and here are the values in each family, and here's where there's discrete opportunity for raising our children based on those values. In terms of this strategic plan, what we did was go out into communities across the state of Vermont and say, tell us, how do we create the best positive environments that are going to contribute to a child's potential development? So what you're seeing in that one is, things around safe communities, like how are we thinking about playgrounds? How are we making sure there are sidewalks and access to what a community should have? Do we have the right educational and institutional facilities? Do we have, the right things in place to ensure healthy environments such as climate, right? And then thinking about resilience. So in terms of the decision-making on the strategic plan, not just this one, but overall, we had, again, over 300 partners, but then the full state advisory council do a formal vote. We had advisory committees and a 1.5-year long process to essentially narrow down, here's what families and communities said in this year in particular. Here's what the data over the last 5 years across all of the sectors tell us. And then we triangulated all of that, meaning we brought all of that information together and really tried to understand, how do we narrow this down and how would we make measurable goals in a 5-year period? And then how would we transition those 5-year goals into 1-year goals?
Yes. So I fully understand this is aspirational.
Absolutely.
To my colleague's point, goal number 1 and number 2 are they appear at first blush to be more family centric, which I think was what Hefner was talking about, asking. So that's like, from my perspective, that's like 2/3 of the day is kind of family oriented, family responsibility. And there's a heavy criticism now that that we're a lot of family responsibility has migrated to state responsibility, which has come with a cost. So we're talking about mental health in schools, et cetera, which all have a price tag. And I'm wondering if you recognize kind of like if there's a saturation point when it comes to state treasury on how we achieve these goals, and which are kind of lower cost, low hanging fruit versus what's additional investment, make sure that all, whether the family unit is or is not, is considered hypothetically not providing some of these basic structures, that becomes a state responsibility. Where's the, right? What kind of conversation do you have?
Yeah, so when we were doing the information gathering with families, originally we said, tell us, what does it look like on the ground and where are you really struggling? We talked with providers, so not just the family, but what are we as communities providing? To stay with basic needs for just a second, the things that kept coming up were housing, food, income, transportation, economic security, the things that really contribute to, for this committee in particular, kids' ability to show up ready to learn at school. And one of the things that we worked really hard on was to say, yes, there's a big lofty goal. What you're not seeing is that within each goal, there are also 4 objectives, and those are more concentrated in each area alongside then strategies to actually move. Because again, these 5 goals that you're seeing on the screen right now are things we could work on forever and still not meet. So the conversations are, again, what is the responsibility of the state? Where are we mapping state and federal dollars to meet some of these needs? Where are we using grant and philanthropic dollars to support these efforts? And then where are community partners actually stepping in to do some of this work alongside families? So in this year of the strategic plan and implementation, what we're doing is actually going out and having those conversations with each of the agency leaders, each of the different departments, the treasurer's office, and others to say, where is there already work happening and state level responsibility for specific pieces? Because it's not going to be that any one agency or any one community program is going to be solely responsible for economic security, for example, right? And then what are the goals and the work you're doing in each year to really say, here's what we're prioritizing related to this strategic plan. So we haven't mapped, for example, here's exactly how much state and federal and community funding is going into each area, like housing or food insecurity. But that is part of how we are talking about it with each of those agencies, is how do we understand where our resources are allocated? And if this is really the broad vision that we as a state have agreed to, how are we making decisions based on these things? So if we know we need to prioritize food security, we know we need to prioritize housing as a state, here are the things that if you as a committee are talking about sticking with basic needs, housing, the things that these community partners and state agencies and anyone who's working with kids and families said you should be considering when you're making those funding decisions or potentially policy changes. Sure. All right, let's talk about education for just a second in the strategic plan. So again, I mentioned to you all that goal 3 was really around all of the different areas of high quality opportunity. But for you all in particular, this is where you're going to see things like pre-kindergarten education, early learning, elementary education, things around quality, and education transformation as a whole. Some of the things that I would call your attention to, and again, we don't have to dive in deep, but just so you have a sense of where the things live, are things like early intervention, special education, and really thinking about prevention. So what do we know about access inclusion and how are we reducing things like exclusionary discipline? And so there's strategies and objectives there. There's also a focus on the mixed delivery system. So again, the way that we're providing broad early childhood education services is in that mixed delivery model in childcare, Head Starts, in public education programs. So you're going to see a lot in that area around anything like affordability, accountability, coordination, quality, and what's going on between our agencies and districts and how we're partnering there. One of the key takeaways, if you heard nothing else that I said today, is how are we going to center children and outcomes for children in the context of ed transformation? So as we're thinking about our youngest and most vulnerable learners, and we're thinking about students in pre-K, our 3, our 4-year-olds, our 5-year-olds not yet in kindergarten, what are the priorities that we need to think about, and what are all the considerations in pre-K as we're looking through ed transformation? So I'll talk a little bit about that later, but really wanting to call attention to the fact that when we change one system, like a massive ed transformation, which is really valuable and important, how do we make sure that we aren't breaking some of the other bridges or making adaptations to, again, really think about childcare, Head Start programs, after school and out of school time care at the same time as we're thinking about ed. All right, I do get to talk about a little bit of funding, not all hard things today. But again, as I'm thinking about being an advisor to this group, one of the things we prioritize is providing the most up-to-date, high-quality data to inform decision-making for you all. This is also the point in the presentation that I remind you that I'm not a lobbyist My job is not to come in and tell you this is how you should move on any specific bill, but to say, what data do you need? Let me help you access it. And here's what we know right now. So in terms of the bright spots and what is going really well in the state of Vermont right now, we have a 58% increase in the total number of children who are enrolled in child care financial assistance. So significant increase. And even more so in the infant and toddler enrollment. So that's up by 82%.
Is that positive or negative? Because the negative side is that we're economically stagnated and our families are economically failing. That's
That
kind of,
families are struggling, right? And then
Right.
is that
and more children fall below the poverty line that need this support. So it's, while they may be, maybe the safety net is catching them.
Mhm.
The negative side is that we don't have programs which are keeping families, the entire family unit away from poverty.
That is a totally fair assessment and thinking about where we are from an economic security lens and meeting families' basic needs. I do think that because of the way that we've structured the new program in Act 76, we have the highest eligibility in the country for how we're supporting childcare financial assistance. And
600%.
and so
Poverty index.
right. And so as we're thinking about who we're catching, we are catching such a remarkable number of kids and families. And one of the biggest challenges that we've had in the state in the last 10 years is access to childcare. So the fact that we have more families, and I actually have a full slide on all of the childcare data for you to talk about where infant and toddler care has been the hardest to find and to get parents access to, regardless of income level. So setting aside our subsidy rates, we've always known that from a supply and demand perspective, we've struggled to get kids enrolled in childcare, especially for infants and toddlers. So the fact that we have an 82% uptick in infant enrollment is significant, and not to downplay the fact that our families are still struggling in a range of ways. To talk a little bit about how our kids are doing in literacy and family reading, one of the amazing things, and there's another slide on this as well, is that we are seeing our young kids, specifically in the pre-K period, do really well in math and social emotional development. We're also seeing a decrease in the number of children who are in out-of-home protected custody. So couple of things to call attention to, both in the bright spots, but also really thinking about what we need to monitor over the next couple of years. And again, it's really relevant to education outcomes, right? So we're seeing a striking increase in the number of homeless children. And this one's really difficult. There's another slide that'll really show this in a visual, but we're seeing a 273% increase in the rate of homeless children under the age of 9, which means they are struggling to show up ready to learn in a range of different ways. We also know that we have really low rates of third graders being proficient or above in math and reading. And we are also seeing, to your point around the poverty rates in the state, we're seeing really wide gaps. So regional variation in what our families look like who are experiencing poverty, right? So the percent of children and students living in poverty ranges from 17% in, Champlain Valley School District to 67% in Winooski School District. So again, paying attention to what our families need and how it differs around the state is really important. So when we are talking about the percent and the number of kids who are experiencing homelessness, this is our McKinney-Vento data, so our education indicator related to housing and homelessness. And so what we're seeing is that there's an increase of 626 students under the age of 9 who are eligible for homeless support services. And that's a 273% increase since 2018. So again, just calling attention to something that you said a little bit earlier about what our educators and principals and school districts are facing with children showing up really struggling, ready to learn, whether that is because they are homeless, they are not having food and things that they actually need to come in and thrive in that space. Sure.
Have we coincided this with any, and this might be a sore subject, but for the hotel motel program, because you're looking, as we see where it started to come into effect, that our numbers started going up. And is it families coming in that took advantage of that and then are ending up homeless afterwards? And we're dealing with that. Is there any statistics on that? Or It's just a question. I'm not trying to,
No, I know, it's just, we've been watching the rate of homeless families and children rise since the recession.
Yeah.
So, I mean, I know we have that data.
but that's a huge rise. And it's like, why? Is it because of some programs that Vermont has pulled in?
I think
And I
it's-
just, is there any data on that?
Even, I mean, I would imagine if you look at the year of Tropical Storm Irene, you saw a spike because housing was scarce for people. And they couldn't continue to share housing and have people sleep on their couches, et cetera. So that doesn't tell the full story.
And I would say, and I promise I will give it to you, I think that there's such a range of factors contributing to every indicator that I'm sharing, right? We can't point to any one thing as the primary cause. But I also will work with Miranda's team and ESD to talk more about the hotel motel program. We do have the rates of children and families who have been enrolled and involved in those programs, but I would not point to that as the sole factor.
So the good news is that you captured this data. How often do you update? I mean, and you have, like a decision support template to identify where you need to go shift your focus to? And how does the funding tie into that?
It's so hard to talk about the lack of funding. But so yes, we're all experiencing that. But I think one of the things I would say is that we have relationships now developed with every agency, department, and division that is documenting any data on behalf of kids and families. It involves data sharing agreements. It involves consistent meetings with their data teams, but then they're also their policy teams and leadership to determine the narrative and what are we actually seeing and the interpretation of that data. Because there are examples of data that we'll share with you where sometimes it's really hard to land on a final number across agencies, departments, and divisions, or we need to actually be debating what those contextual factors are that are contributing to those outcomes. So we do receive some funding from the state of Vermont, but we also write federal grants and private philanthropic dollars and posts to bring funding in for this work. I'm not planning on talking about this broadly today, but we did lead the development of a grant that we just received, bringing $12.7 million into the state called the Preschool Development Grant, really focused on early care and education in partnership with the Child Development Division.
I'm sure somehow you can click on one of those bars and it'll tell you by county so that you can shift.
Yes, and we did just make a really big shift actually this year when we were presenting the state of Vermont's children. Instead of publishing the book that sometimes ends up in recycle bins, all of this data is now centralized in a data portal and is broken down by district or county. And I'll show you how to get there a little bit later and can send those links, but it is all publicly available and we work, I want to say on a quarterly basis, but also as data cycles are available. So every indicator that we work with agencies on, their cycle for data collection and documentation differs. So as soon as they have it, we have it, and we make that available.
Right, some of the weeks that we need to keep moving because.
Yeah.
So sorry,
Quick question, going back one slide.
Sure.
Can you confirm that you said that the very bottom line, the 17% of poverty is in the CBU area?
Yes.
And the
Champaign Valley.
67 is in Winooski, which is also in Chittenden County. That's the highest in the state. So, thank you.
Yes.
So I'd like to.
All right. I will go a little bit quicker and I'm not going to talk about every chart on here, but you asked about childcare data and how we're thinking about this. We're specifically charged in Act 76 to monitor this. So as of yesterday in your inbox, you have our Act 76 monitoring report. It has a 4-page data spread that shows you all of the available data right now on childcare and the implementation of Act 76. All of that work is done in partnership with Janet McLaughlin's team, the Deputy Commissioner for CDD, as well as a range of community partners who are capturing this data. At the highest level, what I can tell you is we've made incredible progress since the passage of that bill. Act 76 is being delivered at scale at this point, and we've seen dramatic expansion of access and affordability. So nearly 12,000 children in almost 10,000 families are now eligible for CCFAP. We are seeing stronger financial footing for our childcare programs, and where we're seeing that investment is also coming from our quality and capacity incentive payments. So we've made $12.7 million in payments to over 800 programs to focus on capacity and infrastructure. And our payroll tax is fully implemented and it's operating in the way that it was intended to. I'm going to skip some of the childcare data to talk to you all about pre-K, but I'm also happy to come back in for folks who are interested or talk with you separately more about the pre-K work. Or sorry, the childcare work. So again, anticipating that pre-K is going to be a major topic this session, I want to just do a quick overview of what we know of the data in the last 5 years. The first is that we've ranked as a state second nationally for access for 3 and 4 year olds in our universal pre-K program. That does not mean that we have equitable access to pre-K. That just means that we have the highest rates, or the second highest rates in the country for 3 and 4 year olds who are attending and accessing programs. It's currently 61% of our 3 year olds and 78% of our 4 year olds enrolled, which is great. From a capacity perspective and where we deliver pre-K, I mentioned mixed delivery. So it can be in community-based or public school programs. About 44% of those spots are available in school-based programs, and about 56 are available in center or community-based family childcare homes. What we know about the outcomes is that we are seeing children who attend pre-K are having higher rates of showing up ready to learn in kindergarten. We're also seeing, again, that rise in 4 year olds exceeding expectations in math and social development. We also know from the national data that 2 years of pre-K is beneficial for children.
So the hope I think is that by the time they're third grade, those numbers begin to go up because the system is speaking.
That
Yeah.
would be ideal, and I wish that was what I was about to show you.
Yeah.
But I think here's what I want you to know about this slide. First, the bars on the left-hand side are not showing you a decline in anything. They're showing you a bar for 3 separate assessments for young kids. The pink and the blue are showing the outcomes that we use to track how we're doing for kids in childcare and pre-K. So what we're seeing in pre-K literacy measured by TS Gold is that we have 91% of kids who are doing really well in our pre-K and childcare settings. We also have 85% of our children showing up ready to learn in kindergarten, right? Again, we're not looking at a trend line here, a separate assessment for 3rd grade math and reading, which you all know, which is that by the time we are doing assessments in 3rd grade, our children are struggling. And on the right-hand side, what you're seeing is that those characteristics vary based on the populations and our subpopulations, with our historically marginalized and kids on IEPs really struggling.
Is your point that this is pre-Act 76, potential pre-Act 76?
No, my point on this one is that we're doing really well in outcomes for kids in childcare and pre-K right now. So as you're thinking about investment, as you're thinking about the system and making changes in things like childcare or pre-K in the context of ed transformation, to realize that it's working really well. We have really strong outcomes and we have really great access rates. So as we're making transitions, or as we're thinking about that in the context of ed transformation, how do we maintain the things that are working really well when our outcomes for kids are really great in that 0 to 5 space? All right. I know that I have 2 minutes. So what I'm going to do is skip this slide and tell you that we have a range of policy recs. The one that I think is most important for you all to hear about is specifically related to universal pre-K. Again, this network has come together to say, if you're going to prioritize anything in the early childhood education space, 1, maintain access to pre-K for 3 year olds while you are thinking about expansion for 4 year olds, and to do that within a mixed delivery model. And that is paired with the recommendations that came from the Pre-Kindergarten Education Implementation Committee as well, also aligned with the strategic plan. The second is to make sure that it's funded in a way that works for both school districts and community-based programs, and to really determine what that pupil weighting is or how it's going to be reflected in that foundation formula.
Are you saying that the pre-K weight that's in Act 73 is not appropriate?
I'm saying that we really need to focus for pre-K on understanding the true cost. And I think later this next week, Emily Byrne from the Joint Fiscal Office is going to be presenting data to committees and probably to this committee as well, talking about all of the different potential incentive programs and ways that we're thinking about funding pre-K. But no, right now, our foundation formula is not focusing on pre-K in the same way that it is focused on K to 12 transformation. So one of the major things that everyone is waiting on is our understanding of what the cost is and what the options are for how to move forward with the foundation formula related to pre-K. The last piece I want to name for this group is really thinking about how we prioritize equitable access. So yes, we have great UPK, we have a universal program. There are still areas of the state where kids are not able to access pre-K, and we really need to prioritize those. And, you know, I know that there are other bills like S214 and others really focused on thinking about that service delivery and how we can provide access. So happy to come in and talk more about those areas. I'm going to pause to allow any other questions because I know we're at time, and just note that there is so much more data, qualitative data from the last 5 years that we've captured. And I'll just quickly screen share, but it's also on your slides that were sent. These are the preschool, the PEIC's recommendations that we were a part of. And what we have is qualitative data that specifically says, here's what's working, here's what partners want you to know about this system, and here's some problem solving that we still need to do. So I'm happy to come in at other times once you're tackling pre-K and talk more about that. And another day, I will show you how to use the data portal or come in and talk about
Yeah,
it.
we'd actually, I think we're interested to have you back. And one of the things I'd like to talk about if we had more time
Sure.
is that issue about rural Vermont. I've seen some materials that suggest that while we're doing better overall, it's actually getting worse in rural areas. And I don't know if that's true or not, but I'd like to explore that at some point and make sure. And you raised the issue and so that'd be really interesting to talk
Yeah,
about.
it would be great. I would love to
Yeah.
come back in and
Yeah.
talk about, again, the areas of the state where we're doing really well
Yeah.
and where we have some
Yeah.
work to do.
Well, if she's coming back,
Yeah,
I can make that.
we'll have you back. It sounds like we'll have you back sooner rather than later. Because there's a lot of this, I think a lot of
and
people.
it's more if you can answer the
But
question.
Sure.
I'm trying to be respectful of the community's
Absolutely.
time on a Friday afternoon and
Thank you.
get out of here by 4 o'clock.
Very timely.
Yeah, thank you
Yeah,
all for having
Thank you.
me.
Yeah, we'll have you back soon.
Happy to-
Yeah, okay. So we keep their
A lot of good information.
sheets available. So we're now on to stakeholders.
It's not, it was
3 o'clock.
Oh,
scheduled.
let's see, this is.
I mean, I was with you.
2:45. Oh. You know what? Well, I thought we were going to go into 2:45. But no, that's too bad. I thought we started over at 2:45. Well, we have a break for a few minutes. Okay.